Hello, I'm Dr. E. Barry Gordon. This is my 20th video on testosterone deficiency and the second and last on breast cancer. This is an in case video, in case you've heard or hear at some time in the future that testosterone causes breast cancer. While there is no doubt in my mind that numerous reputable published medical studies, logic and common sense clearly point at testosterone deficiency as being a primary cause of breast cancer, there are some researchers who apparently have the exact opposite opinion. They believe that the presence of testosterone stimulates breast cancer. I'm going to discuss two studies that promote that idea and point out what I see as major flaws. As in previous videos, I've simplified technical words and phrases in order to make the quotes more easily understood. The unaltered quotes are on my website, www.thehiddendisease.com. You'll also find there many dozens of other medical studies, all previously released videos in the series, and many videos of my patients describing their experience with testosterone replacement. I read an article within the past year or so that found that the recurrence of breast cancer was associated with higher testosterone levels, that women with the highest levels of testosterone have 7 times the risk of breast cancer recurring. I misplaced that article and was unable to find it on a search of medical literature, but I did find a similar study. It came out of Italy and was published in the January 2005 issue of the International Journal of Cancer. The purpose was to see if a relationship existed between ovarian hormone levels and the rate of recurrence of breast cancer. Their primary conclusion, quote, "High testosterone predicts breast cancer recurrence," close quote. It's important to understand that this study has nothing at all to do with elevated testosterone levels or even with replacing testosterone, but only with how much testosterone these various women had lost. They went on to suggest that a reduction in the amount of testosterone might reduce the incidence of breast cancer recurrence, clearly indicating that they believed testosterone was responsible for the higher rate of cancer recurrence. Naturally, that shook me up a little, but only until I gave it some thought. It turns out that this is an excellent lesson in the folly of confusing an association of findings with cause and effect. Any study promoting a causative relationship between testosterone and breast cancer has to brush aside some very basic facts. Most women begin to lose testosterone between 25 and 35, and breast cancer rates begin to increase in the early 40s. So it's inescapable that essentially all women who get breast cancer have lost much or most of their testosterone. Now, it is very well known that breast cancer beginning in younger women is a much more aggressive and virulent disease than breast cancer beginning in older women. Here are a couple of quotes of the National Cancer Institute. Quote, "Clinical observations and studies indicate that late onset breast cancers grow more slowly and are less aggressive than early onset breast cancers." Quote, "Findings from archives demonstrated that late onset breast cancers have slower growth rates, are more stable, and more likely to respond to anti-estrogen medications." Close quote. It's also basic biology that the younger the woman, the less testosterone she will have lost, and of course, the more testosterone she will have. So obviously there will be a statistical association between breast cancer recurrence and higher levels of testosterone, just like there would be an association between breast cancer recurrence and less facial wrinkles or less gray hair. To put this matter completely to rest, not only has the National Institute of Health repeatedly suggested that testosterone may prevent breast cancer, but a more recent study on hormone levels and breast cancer recurrence came out of the University of California, San Diego. It was published in March 2008. Their findings, quote, "Testosterone concentrations did not differ between cases and controls and were not associated with risk for recurrence." Close quote. Another study promoting a causative relationship between testosterone and breast cancer came out of very prestigious institutions, the Brigham and Women's Hospital and Harvard Medical School. It was published in the July 2006 issue of the Archives of Internal Medicine and was titled Combined Estrogen and Testosterone Use and Risk of Breast Cancer in Postmenopausal Women. Here are a couple of statements made in the study concerning the risk of testosterone causing breast cancer. Remember that the word endogenous means made in the body, in this case made in the ovaries. Quote, epidemiologic studies suggest that endogenous testosterone levels are positively associated with breast cancer risk in postmenopausal women. Quote, women using estrogen and testosterone therapies have a significantly increased risk of breast cancer. Close quote. They are saying that testosterone, whether it comes from the ovaries or from a pill, increases the risk of getting breast cancer. Of course, the same very basic and very glaring facts directly confront this study's conclusions. As I explained earlier, most women's testosterone peaks somewhere between 25 and 35. It's about half gone by the time they're in their early 40s, which is when the incidence of breast cancer starts to rise rapidly. So it's uncommon or even rare for women with adequate amounts of testosterone to get breast cancer. If testosterone predisposed to breast cancer, why don't younger women with more testosterone get it? Furthermore, two of the major non-genetic promoters of breast cancer, namely advancing age and female hormone replacement, are both associated with very low testosterone levels. I carefully reviewed this entire study. I must admit that much of their statistical analysis was way over my head, but I accept their numbers. Aside from the discrepancy between this study finding a 15% increase in the rate of breast cancer among women who took only estrogen, while the larger, more recent Women's Health Initiative found a 15% decrease, a couple of minor statements confused me. It was labeled as a prospective study, but actually they looked back at data collected from the ongoing Nurses' Health Study between 1978 and 2002. It was also stated that the study addressed the effect of oral estrogen and testosterone therapy on the risk of breast cancer. But I don't understand how a look-back study of this kind can possibly differentiate between cause and effect, or just a statistical association, as was the case in the first study. There was another, more important part of their presentation that also confused me. As I quoted earlier, it was repeatedly stated throughout this study that endogenous testosterone produced by women's ovaries increased their risk of breast cancer. Since this study had nothing at all to do with endogenous testosterone, they were using the findings of other studies to support their conclusions. However, the following statement from the same research group appeared in the April 2005 issue of the Journal of the National Cancer Institute. Quote, postmenopausal hormone users had higher estrogens and testosterone and lower free testosterone concentrations than non-postmenopausal hormone users. We learned two things here. This group uses the word testosterone to mean total testosterone, almost all of which is inactive. And while the total testosterone was higher in that study, the free testosterone levels, the biologically active testosterone, were lower. From their use of the words, it would appear that this more current study also used the word testosterone to mean the mostly inactive total testosterone. If the active free testosterone is low, when the inactive total testosterone is high, why do they blame testosterone for stimulating breast cancer? Aren't they actually supporting my contention that low testosterone activity promotes breast cancer? By far the most important issue with this study, which I believe casts major doubt on the validity of the conclusions, is: were the findings based on an unbiased, unskewed, average population of women? You need to know that EstroTest, which became available in the United States in 1964, is a pill containing estrogen and a form of testosterone, and that the only official FDA-approved indication for EstroTest is, quote, moderate to severe flushing associated with the menopause in those patients not improved by estrogens alone, close quote. So keep in mind that the deficiency of testosterone is an established cause of menopausal flushing, and that the only officially approved reason to prescribe the testosterone in EstroTest is the prior failure of female hormones alone to control the flushing. Now back to the study. According to their 1998 statistics, EstroTest accounted for over 90% of the testosterone used by the women, and as would be expected, almost 98% of them had previously used other hormone replacement therapy. Other hormone replacement therapy, of course, had to have been the cancer-promoting female hormones. In 1998, very few of these nurses would have been prescribed EstroTest off-label, meaning that they had to have had severe flushing that wasn't helped by female hormones in order to get the prescriptions from their doctors. These specific nurses, then, were anything but typical. Their need for testosterone, the very fact that testosterone was prescribed for them, identifies them as a group of women with the most severe testosterone depletion, which led to more severe menopausal symptoms that were inadequately responsive to female hormones alone. Again, the study actually gives more support to my contention that it is the testosterone deficiency in the presence of estrogen and progesterone that is a primary cause of breast cancer. It is far more logical that the testosterone-treated cancer victims got their cancer because of their prior female hormone replacement in the face of the severity of their testosterone deficiency, rather than from simply giving them some pills containing testosterone. I wasn't able to find data in this study on the time interval between the women starting EstroTest and having breast cancer diagnosed. But as was stated in the study, quote, in contrast to observing the beneficial effects of testosterone replacement, the development of breast cancer can take years. Actually, it can take many, many years. So it is very likely that a substantial number of these severely testosterone-depleted women already had early breast cancer from their female hormone replacement before they were even started on EstroTest. My interpretation of this study has substantial research support. Not only did the previously mentioned University of California study fail to find a connection between higher testosterone levels and breast cancer, but the National Institute of Health stated quite the opposite in a study published in the September 2004 issue of Menopause. Quote, these observations suggest that the addition of testosterone to conventional hormone therapy for postmenopausal women does not increase and may indeed reduce the hormone therapy-associated breast cancer risk. Is there any other reason to believe that increased levels of testosterone do not cause breast cancer? There is a group of women who consistently have abnormally high testosterone levels. These are women with the polycystic ovary syndrome, also known as the Stein-Leventhal syndrome. There have been several studies looking at the rate of breast cancer in these women with excessive testosterone. Most have found no difference in their risk of getting breast cancer, while one study showed a reduced risk. And finally, I am also unaware of any increase in breast cancer among female athletes and bodybuilders who take very high doses of testosterone for years, if not decades. This study sought to answer the question of whether postmenopausal women taking testosterone were at greater risk of getting breast cancer. They found the answer to be yes. But it doesn't seem that they looked at the question of whether it was the taking of the testosterone that caused the increased cancer or the reason for the taking of testosterone. All the evidence and all the logic and all the common sense point to the latter being the case. The tragedy of breast cancer in women is going to continue because after over a half-century of testosterone being available by prescription, there are apparently no definitive studies being done on the role of testosterone deficiency in that and other diseases. Our own National Institute of Health, with laboratory and clinical evidence, has repeatedly demonstrated the likelihood that low testosterone levels, which ultimately occur in all women, predisposes to getting breast cancer. This highly probable, deadly association between testosterone deficiency and breast cancer is being ignored. Not only do studies on testosterone's effect on breast cancer have to be initiated, but in my opinion, the case for testosterone deficiency causing the horror of breast cancer is so compelling in the face of over a half a century of no significant testosterone side effects that the burden of proof should be on why not to take testosterone. The next two videos will be about type 2 diabetes. If you're a woman, or if you care about women, help me spread the word about the existence of this disease of testosterone deficiency. Nothing is going to change in our lifetimes unless the public brings pressure to bear on the medical establishment. I'm Dr. E. Barry Gordon. Thank you for watching.